Hello, this is Dr. David Green, CEO of the Washington Pain Network. Today's topic is what you need to know about facet joint syndrome, which essentially is facet joint arthritis. Every level of the spine has two facet joints. All right, you can see here on the back of the spine on the left, this is a thumbnail-sized joint, another one on the right, another one here, another one here. They contain cartilage just like other mobile joints, the hip, the knee. They allow individuals an impressive range of motion when you add them all together. Even though they're very small, they can be a tremendous source of pain. Facet joint arthritis starts in the disc. So you start to get degenerative disc disease, which is on the front of the spine here, and then you have it in the disc, okay? This shifts abnormal pressures to the back of the spine into these facet joints. And it can start to cause overgrowth of bone and soft tissue and degeneration of the cartilage in the joint, and that starts to lead to facet joint arthritis. There is no effective facet replacement like in the hip or the knee. This is what makes facet joint arthritis more complicated. It's not a ball and socket joint. It's not as simple. So what you end up with is we haven't been able to get a facet joint replacement that works. All right. So usually you have more than one facet joint affected, usually 2 to 5, 7, 10, what have you. You only have 2 knees, 2 hips, and 40 facet joints. So even small joints may produce significant pain, or you may have a lot of arthritis and no pain. So why do people develop facet syndrome? Most commonly it's from good old degenerative wear and tear arthritis called osteoarthritis. You can also get post-traumatic degeneration, such as after a whiplash injury. And there's also a genetic component, which we don't understand very well. The problem is diagnosed by a combination of things. History, physical exam, x-rays can be highly suggestive. So you can have severe arthritis and no pain at all at that level. So interventional procedures that can be used are both diagnostic and therapeutic. So here you have a procedure called a medial branch block. Here's a facet joint, here's a facet joint, there. These little nerve endings around here, those are called the medial branches. They have sensation to the joint, no motor function. So when you deaden them, then it can change the way the brain perceives pain signals because they're not actually getting the signals when you deaden it with the lidocaine and the steroid. Okay? A facet joint injection is very similar, just the needle goes actually into the joint and steroid is administered along with numbing. Additional treatments, medications include non-steroidal anti-inflammatories and Tylenol over the counter. Prescription medications may include short-term opiates for exacerbations. There's also some prescription pain creams that work extremely well. Physical therapy and chiropractic treatment. TENS units, which are about the size of an iPod. They emit electrical impulses through the skin and change the way the brain perceives pain signals. Very low risk, very easy. Spinal decompression therapy, as you can see here, involves intermittent computerized spinal traction to produce a negative pressure in the disc, which pulls in blood supply, nutrients, and oxygen for healing. So the medial branch block, as mentioned, is a great treatment. Here you have a nerve root. All right, we're not talking about that. We're just talking about these nerve endings of the medial branches that come off. Okay, supply sensation to the joint. If you put numbing medicine and steroid around this area, it will deaden that transmission. So the other one is to put a needle right into the joint. If those work and then wear off, a radio frequency ablation can be very effective. There's the needle going into the joint for the intra-articular injection. As you can see here with the radiofrequency ablation, what you're doing is a catheter is placed around the facet joint, and then it's heated up, and these little nerve endings are deadened. Okay, and that can provide pain relief anywhere from 6 to 18 months. Very impressive pain relief. The typical outcome with the medial branch block is 85% effectiveness. The average pain relief is 3 to 4 months. So not only does it give the pain doctor diagnostic information that the facet joint is causing pain, when relief happens, but it also can give relief in and of itself therapeutically for 3 to 4 months. Radiofrequency ablation is 80% excellent results, 6 to 18 months, and studies have also looked at repeat RF procedures and shown the same results. All in all, over 95% of patients are able to achieve a satisfactory non-operative outcome with facet syndrome. The top non-operative pain management in Washington is through the Washington Pain Network. There are multiple clinics throughout the state. Over 50 insurances are accepted, and over 25 treatment options are provided by the board-certified award-winning doctors. All in all, over a 90% average success rates are seen. Visit us online at washingtonpainnetwork.com and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Green with the Washington Pain Network. Your pain stops here.